डॉक्टर नेथन ब्रायन एक मारूफ बायोकेमिस्ट हैं जिन्होंने नाइट्रिक ऑक्साइड बायोकेमिस्ट्री में अहम कामयाबियां हासिल की हैं।
I spent the next 25, 30 years studying nitric oxide, how the human body makes it, what goes wrong in people that can't make it.
खून की नालियों को फैलाने में मदद करता है, जिससे ब्लड प्रेशर कंट्रोल में रहता है। दिमाग में ये न्यूरॉन्स की हिफाजत करता है और याददाश्त को बेहतर बनाता है।
And you use antiseptic mouthwash or exposed to fluoride, it kills the oral microbiome and you get no nitric oxide benefit from diet. All the things we know that contribute to longevity and good health can all be associated with activation of nitric oxide production.
हेलो और अस्सलाम वालेकुम। मेरा नाम डॉक्टर आमिर खान है और मैं आपकी खिदमत में रानी चैट जीपीटी के साथ आपकी खिदमत में हाजिर हूँ। रानी जी
अस्सलाम वालेकुम, मैं रानी चैट जीपीटी और हम आपकी खिदमत में हाजिर हैं सेहत का धमाका विद रानी चैट जीपीटी और डॉक्टर खान के साथ। हम आपको दुनिया भर की अपडेटेड रिसर्च, यूनिवर्सिटी पेपर्स और लेटेस्ट गूगल इंफॉर्मेशन फराहम करेंगे। डॉक्टर खान सवाल जवाब करेंगे और उनका बैकग्राउंड ये है एमएससी ऑर्थोपीडिक्स यूनिवर्सिटी कॉलेज लंदन से, एफआरसीएस आयरलैंड से और वो बोर्ड सर्टिफाइड है इंटरनल मेडिसिन, क्रिटिकल केयर मेडिसिन, पल्मोनरी मेडिसिन और स्लीप मेडिसिन में।
बरसों से हमें बताया जा रहा है कि दिल की बीमारियां, थकन और बढ़ती उम्र जिंदगी का एक आम हिस्सा है। लेकिन अगर हम एक इंतहाई अहम पहलू को नजरअंदाज कर रहे हों तो अगर बेहतरीन खून की गर्दिश, तेज दिमागी सलाहियत और तवील मुद्दी तवानाई की चाहत में हम अपने जिस्म पर असर अंदाज कर रहे हों, आज हमें यह पता है कि नाइट्रिक ऑक्साइड की हैरान कुन साइंस की दरियाफ्त कर रहे हैं। इसकी दरियाफ्त 1999 में बायोकेमिस्ट डॉक्टर ने जब नोबेल प्राइज जीता तो तब पहली दफा हमें इसकी आगाही का एहसास हुआ है। उस वक्त से नाइट्रिक ऑक्साइड के बारे में बहुत ज्यादा रिसर्च हुई है और उससे आगे इसके असरात दिल पे, किसी की एथलेटिक परफॉर्मेंस पे, यहाँ तक कि एजिंग के लिए मोजजाती मॉलिक्यूल क्यों कहा जाने लगा है, क्यों ज्यादातर लोग इसके बारे में बात नहीं कर रहे। खुश आमदीद एक और बसीरत अफरोज किस्त में खान क्लिनिक्स में मैं आपका मेजबान डॉक्टर आमिर खान। आज हमारे साथ एक नहायत मोहतरम मेहमान मौजूद हैं, डॉक्टर नेथन ब्रायन, होस्ट डॉक्टर खान। Today we have the honor of having Dr. Nathan Bryan, a pioneering scientist whose groundbreaking research in nitric oxide biochemistry has changed our understanding of cardiovascular health and disease prevention. Dr. Bryan is an internationally recognized leader. His expertise in nitric oxide biochemistry, he's the CEO of the Nitric Oxide Innovations, a clinical stage biopharmacological company. Dr. Bryan has earned his science degree in biochemistry from UT Austin and his Doctor of Philosophy from Louisiana State University of Medicine. He received the Dean's Award for Excellence in Research there. He's the first to identify nitric oxide and nitrate as indispensable nutrients essential for optimum cardiovascular health and demonstrated their endocrine function through formation of inorganic nitrite. He's authored several books, including Food, Nutrition and Nitric Oxide Pathway, Nitrates and Nitrites in Human Health and Disease, and Blood and Disease Nitric Oxide Products. रानी, डॉक्टर नेथन ब्रायन का तारफ करवाइए जरा।
जी डॉक्टर खान, डॉक्टर नेथन ब्रायन एक मारूफ बायोकेमिस्ट हैं जिन्होंने नाइट्रिक ऑक्साइड बायोकेमिस्ट्री में अहम कामयाबियां हासिल की हैं।
उन्होंने अपनी बैचलर्स डिग्री यूनिवर्सिटी ऑफ टेक्सास से और पीएचडी लुइजियाना स्टेट यूनिवर्सिटी से हासिल की। उन्होंने नाइट्रिक ऑक्साइड पर मुताद्दिद पेटेंट्स हासिल किए हैं और बोस्टन यूनिवर्सिटी में पोस्ट डॉक्टरेट ट्रेनिंग की है। वो ब्रायन थेरापेटिक्स के बानी हैं, जो नाइट्रिक ऑक्साइड पर मबनी इलाजी तरीकों पर काम करती है। उन्होंने इस मौजू पर 5 किताबें भी लिखी हैं।
जी रानी, सबसे पहले आइए हम सुनते हैं कि उन्होंने नाइट्रिक ऑक्साइड को कैसे समराइज किया है और उन्होंने क्या बताया है कि नाइट्रिक ऑक्साइड का क्या रोल है और उसको क्यों इम्पोर्टेंस है। तो आइए उनके पहले 2 सवालों का जवाब सुनते हैं। By asking you, what sparked your interest in this specific field of science? And then how did your passion evolve to doing research after that?
Well, I've always had an interest in science and medicine, even going back to high school. But, I had a chance to do undergraduate research at University of Texas at Austin and really get a sense for the feeling of discovery and really the intellectual freedom to ask any question you want and then design a set of experiments to get an answer for that. But really, so I've always had an interest in science and I guess just general curiosity. But I got introduced to the science of nitric oxide in 99, I believe it was maybe 2000. So just after a Nobel Prize was awarded, I was a student at LSU School of Medicine. I was working on a PhD in molecular and cellular physiology. And, Lou Ignarro came and spoke before the student body, and he had just won the Nobel Prize for the discovery of nitric oxide. And, so we knew it was a very important molecule. And, Lou made a very profound statement to me that night at dinner. And he said, look, Nathan, he goes, if anybody can figure out how to restore and recapitulate nitric oxide production and develop drug therapy or product technology, it'll change the world. And it'll change the landscape of medicine and healthcare, because even, what was that, 25, 26 years ago, there was an appreciation that it's loss of nitric oxide that's what leads to the onset and progression of chronic disease. So that profound statement really motivated me to go, well, if we can figure that out, then, that's really a legacy leaving place. So, I spent the next 25, 30 years studying nitric oxide, how the human body makes it, what goes wrong in people that can't make it. And then once we got the answers to those questions, we could start developing rational drug therapies and product technology to restore the production of this simple gas.
Excellent. And thanks for explaining that. So you develop an interest and then you're associating or trying to find ways why nitric oxide is so crucial for maintaining good health, and what is its role in the human body. How would you summarize it?
Well, at the core, it's a signaling molecule. So it's produced by one cell. It affects the function of neighboring cells and produces physiological responses. So it's primarily known as a vasodilator, right? So when nitric oxide is produced, it causes blood vessels to widen and dilate. It's a bronchodilator as well. So it relaxes smooth muscle. So there's smooth muscle that surrounds bronchioles. There's the airways, there's smooth muscle that surrounds all blood vessels. So when smooth muscle relaxes, it dilates the blood vessels and improves oxygen uptake, oxygen nutrient delivery. But it's, that's just part of the story. That's what the Nobel Prize was awarded for the discovery of nitric oxide as a signaling molecule in the cardiovascular system. But we know it's produced by neurons in the brain. It's a neurotransmitter. We also understand that it's responsible for our innate immune system and killing off bacteria and viruses and preventing virus from replicating. But it's a longevity molecule. You mentioned aging and vitality. It induces or signals our stem cells to mobilize and differentiate to repair and replace dysfunctional cells. It prevents telomeres from shortening, the ends of our chromosome that predicts lifespan. And it induces mitochondrial biogenesis that improves the energy production within the mitochondria of cells. So what we know today is nitric oxide is really the longevity molecule. It controls every aspect of aging and the prevention of.
रानी, तो फिर हमें बताएं कि नाइट्रिक ऑक्साइड के रिसर्च करके क्या तुम्हें रोल्स मिले हैं?
जी डॉक्टर खान, नाइट्रिक ऑक्साइड के अहम किरदारों में से एक ये है कि ये खून की नालियों को फैलाने में मदद करता है, जिससे ब्लड प्रेशर कंट्रोल में रहता है। ये दिल की सेहत को बेहतर बनाता है, दिमागी अफ़ाल को सपोर्ट करता है और जिस्मानी कारकर्दगी बढ़ाता है। इसके अलावा ये एंटी इन्फ्लेमेटरी असरात भी रखता है, जो उम्र बढ़ने के असरात को कम करने में मददगार साबित हो सकते हैं।
रानी रिसर्च करके बताओ कि इसके लंग्स में, ब्रेन में और इम्यूनिटी में, एजिंग में और माइटोकॉन्ड्रिया में क्या रोल है?
जी डॉक्टर खान, नाइट्रिक ऑक्साइड फेफड़ों के लिए बहुत मुफीद है। ये फेफड़ों की खून की नालियों को फैलाता है, जिससे ऑक्सीजन की फराहमी बेहतर होती है। दिमाग में ये न्यूरॉन्स की हिफाजत करता है और याददाश्त को बेहतर बनाता है। कुव्वत मदाफियत में ये इन्फेक्शन से लड़ने में मदद करता है। उम्र बढ़ने के अमल में ये खुलियों की सेहत को बरकरार रखता है और माइटोकॉन्ड्रिया की फंक्शन को सपोर्ट करता है, ताकि तवानाई की पैदावार बेहतर हो।
चलें, आइए आप डॉक्टर ब्रायन का सवाल का जवाब, हमने अगले सवाल का जवाब सुनते हैं, जिस पे हमने उनसे पूछा कि नाइट्रिक ऑक्साइड डाइट में किस किस चीज़ों से मिल सकती है. Explaining that, what would you say would be good dietary sources of nitric oxide? And if someone wants to boost his levels, how do you go about doing that? And what sort of recommendations or suggestions would you give to the general public?
Well, the first thing I would recommend, because it's based on the science and the data, is you got to eliminate sugar and anything that leads to an increase in blood glucose levels, whether it's sugar-containing sodas or high glycemic index foods, simple carbohydrates. Because once you understand, sugar or glue, what we measure in the blood, or glucose is glue, right? Like the root. So it's sticky. It's a very sticky molecule. And when glucose sticks to proteins and enzymes, it basically inhibits their activity. So glucose sticks to hemoglobin, right? And we can measure this in the peripheral blood, and we call that hemoglobin A1C. But hemoglobin sticks to the enzyme that makes nitric oxide, and it makes it sticky, so it can't transfer electrons and produce nitric oxide. So number one, you got to eliminate sugar from your diet. And then number two, green leafy vegetables that are enriched in inorganic nitrate are effective at producing nitric oxide, provided you have the right oral microbiome and provided that your stomach can make stomach acid or hydrochloric acid. So diet really means nothing if you use fluoride in your toothpaste, antiseptic mouthwash, or you have patients that are on antacids, specifically the proton pump inhibitors. Because what the data have told us, that if you're on antacids and you use antiseptic mouthwash or exposed to fluoride, it kills the oral microbiome and you get no nitric oxide benefit from diet.
Interesting.
So those are very important components
Very
that
interesting.
most people don't recognize. So we have to get rid of fluoride. We have to stop using mouthwash, and we have to wean patients off of antacids because your body cannot heal or produce nitric oxide.
तो रानी, आप जरा हमें रिसर्च करके बताएं कि डाइटरी सोर्स, जो कि एक नेचुरल सोर्स है, वो कौन से सोर्सेज से हमें मिल सकती है नाइट्रिक ऑक्साइड? तो आइए सुनते हैं फिर रानी का जवाब.
जी डॉक्टर खान, नाइट्रिक ऑक्साइड के लिए किन कुदरती जराए हैं जिनमें खास तौर पर नाइट्रेट से भरपूर सब्जियां शामिल हैं, जैसे पालक, चकंदर और लेटिश। इसके अलावा चकंदर का जूस और गोभी भी बेहतरीन जराए है। खरबूजा और अनार में भी नाइट्रेट्स पाए जाते हैं, जो जिस्म में नाइट्रिक ऑक्साइड की सतह को बढ़ा सकते हैं।
How would you say, besides diet, your lifestyle, exercise, stress, sleep, the big threes,
That's right.
how would you think they affect the body nitric oxide levels? How can we boost them, and what detrimental effect can it have if the levels are low?
Well, the science of nitric oxide and the biochemistry is pretty complex, but the solutions are really pretty simple. So exercise is medicine because exercise stimulates and activates nitric oxide production in the lining of the blood vessels. So if we have good endothelial function, so the enzyme that makes nitric oxide is found in our endothelial cells that line all blood vessels and in our epithelial cells that line the airways, the upper airways and the sinuses. So when we activate these enzymes through shear stress in the lining of the blood vessels, if we start to exercise, then that turns on nitric oxide production. If we do nasal breathing and activate the epithelial cells, it produces nitric oxide in the upper sinuses and delivers nitric oxide into the lower airways. So it acts as a vasodilator and a bronchodilator. So just moderate physical exercise, nasal breathing. So if you can get your heart rate up, deep breathing, that'll activate and stimulate nitric oxide production. And then obviously sleep is very important. Patients with obstructive sleep apnea are at increased risk for heart attack and stroke because we need oxygen to make nitric oxide. So if you're hypoxic from sleep apnea, You can't make nitric oxide. You can't mobilize stem cells. You can't repair and replace dysfunctional cells and regenerate while we sleep. So sleep is critically important. And then, as you mentioned, stress, chronic activation and overproduction of cortisol creates a fight or flight response, sympathetic overload, and it shuts down nitric oxide production. So all the things we know that contribute to longevity and good health can all be associated with activation of nitric oxide production. And all the things that we know contribute to the advanced progression of chronic disease have all been shown to inhibit.
तो नाजरीन, आपने सुना कि डॉक्टर ब्रायन ने हमें बताया कि एक्सरसाइज और स्लीप और स्ट्रेस पे क्या असरात हो सकते हैं नाइट्रिक ऑक्साइड के। रानी, रिसर्च करो और हमें बताओ कि एक्सरसाइज, स्लीप और स्ट्रेस पे जो डॉक्टर ब्रायन ने बताया उसको समराइज करके हमें बताओ कि क्या असरात है नाइट्रिक ऑक्साइड के।
जी डॉक्टर खान, नाइट्रिक ऑक्साइड के असरात वर्जिश, नींद और तनाव पर काफी मुस्बत होते हैं। वर्जिश के दौरान ये खून की नालियों को फैलाकर पट्टों तक ऑक्सीजन की फराहमी को बेहतर करता है, जिससे कारकर्दगी में इजाफा होता है। नींद में बेहतरी लाता है क्योंकि ये रिलैक्स करता है और ब्लड प्रेशर को कम करता है। तनाव के असरात को कम करने में भी मददगार है क्योंकि ये एंटी इन्फ्लेमेटरी असरात रखता है।
और स्ट्रेस और सिंपैथेटिक एक्टिवेशन में भी बताओ हमें नाइट्रिक ऑक्साइड का क्या रोल है।
जी डॉक्टर खान, नाइट्रिक ऑक्साइड तनाव के दौरान सिंपैथेटिक नर्वस सिस्टम की सरगर्मी को मुतवाजिन रखने में मदद देता है। ये खून की नालियों को रिलैक्स करके ब्लड प्रेशर को कम करता है, जिससे दिल पर बोझ कम होता है। इसके अलावा ये एंटी इन्फ्लेमेटरी असरात भी रखता है, जो जिस्म को तनाव के नुकसानदेह असरात से बचाता है।
तो नाजरीन, आपने सुना कि अगला सवाल का जवाब वो ये था, हमने पूछा कि एजिंग में नाइट्रिक ऑक्साइड का क्या रोल है। तो आइए सुनते हैं डॉक्टर नेथन की जुबानी, वो क्या बताते हैं। बिफोर वी कम टू योर रिसर्च, वी वांट टू नो, you've mentioned that nitric oxide decreases as we age. Is there any strategies we could deploy to mitigate this? And why does it decrease?
Absolutely. So if you look at, and these studies come from just looking at different age groups, from early teens to 20s and 30s, and really the compilation of data show that each decade. And so through these studies, what we're looking at is endothelial function. So they can infuse bradykinin and acetylcholine in the brachial artery and the coronary arteries and look at the subsequent vasodilation. So this is looking at how functional the enzyme is in the lining of the blood vessel. And so what we see in the normal population is this age-related decline. So the older we get, the less we make. But today we know that doesn't have to be the case. And we can accelerate or decelerate that process. We see now, if you look at that chart, we've got 18, 20-year-old kids that have a vascular age of a 50 or 60-year-old.
Wow.
And, I'm 51, but I've got the vascular age of a 36-year-old. So we know how to mitigate this and prevent this age-related decline and maintain NOS coupling and normal endothelial function. But it takes a lot of discipline. It takes diet. It takes lifestyle. There's some genetic predispositions that some people may unfortunately be compromised with because of their own genetics or single nucleotide polymorphisms and, the eNOS gene or the MTHFR gene. So there are many things that contribute to it, but we understand the science and we know how to mitigate.
Aging में क्या उसका रोल है?
जी डॉक्टर खान, नाइट्रिक ऑक्साइड उम्र बढ़ने के अमल को सुस्त करने में अहम किरदार अदा करता है। ये खुलियों को ऑक्सीडेटिव स्ट्रेस से बचाता है, शरियानों की लचक को बरकरार रखता है और माइटोकॉन्ड्रिया के फंक्शन को सपोर्ट करता है, जिससे तवानाई की पैदावार बेहतर होती है। इस तरह नाइट्रिक ऑक्साइड सेहतमंद बुढ़ापे में मददगार साबित होता है।
डॉक्टर ब्रायन का 5वें सवाल का जवाब और 5वें 6वें सवाल का जवाब था कि उनका ब्रेक थ्रू रिसर्च क्या थी। तो आइए पहले उनसे सुनते हैं, तो फिर रानी से सुनते हैं। Associated with one of the very important discoveries, and that's the endocrine function of the nitric oxide. When you discovered the formation of the S-nitrous glutathione and the inorganic nitrate, could you explain that to the layman people here? What does that mean, and why was it so significant?
Well, it was my eureka moment in science, and I think it's the epiphany that you hope for as a basic scientist that really changes the way we think about nitric oxide. So we have to go back and understand the physical chemistry of nitric. So nitric oxide, once it's produced, it's a gas. So it diffuses in all three dimensions. It's gone in less than a second. So the prevailing thought was that nitric oxide can only act in the cell in which it was produced, an autocrine function, or a neighboring cell, a paracrine function. And so what we discovered in our 2007 paper that we published in the Proceedings of the National Academy of Science was the first demonstration that nitric oxide is a hormone. And so when you look at hormones, hormones are produced in what we call endocrine glands, but they're produced in one organ, but they have systemic effects, right? So testosterone produced in the testes has effects on the heart, the kidneys, it has systemic effects. Same thing with thyroid, produced in the thyroid gland, but it has systemic effects. So what we discovered is that nitric oxide that we intentionally overproduced in the heart had protective effects on the liver.
Wow.
So the nitric oxide that was produced in one organ had distal effects that elicited a cytoprotection in the liver.
Excellent.
So the aha moment, so then nitric oxide fits all the definitions of a hormone. It's a chemical molecule, NO, one nitrogen, one oxygen. It's a signaling molecule produced in one part of the body, has distal effects, affects the structure and function of a distal organ. And nitric oxide fits all of those. So when nitric oxide is produced, it's oxidized to inorganic nitrite. It binds to the cysteine residue of glutathione, and it's transported as S-nitrosoglutathione. But those are the cytoprotective, and that transduces the nitric oxide activity. So what that means now is when we start to consider nitric oxide-based therapies, what we're doing is what's called hormone replacement therapy. And that's no different than men with low T or low testosterone, right? We give them testosterone. We don't give them precursors. We don't give them, pregnenolone or DHEA in hopes their body can make testosterone. We give them testosterone.
Correct.
Same thing with women. And fortunately, we don't have to give the testosterone in the testes, right? We don't have to give it in the organ in which it was produced. We can deliver it transdermally, sublingually. So the same thing with nitric oxide. If you're low in nitric oxide, then we have to deliver the nitric oxide molecule to you. And that was the basis for all my discoveries and innovations, because I can deliver nitric oxide in the oral cavity. I can deliver a certain amount of nitric oxide over a certain period of time that can completely recapitulate nitric oxide signaling and nitric oxide production in the human body. And that's hormone replacement therapy. We're just doing it with nitric oxide.
रानी, हमें रिसर्च करके बताओ कि इस सवाल का जवाब डॉक्टर ब्रायन की क्या रिसर्च ब्रेक थ्रू थी?
जी डॉक्टर खान, डॉक्टर नीथन ब्रायन की ब्रेक थ्रू रिसर्च नाइट्रिक ऑक्साइड के बायोकेमिस्ट्री पर मरकूज थी। उन्होंने पहली बार ये दरियाफ्त किया कि नाइट्रेट से भरपूर ग़िज़ा और सप्लीमेंट्स नाइट्रिक ऑक्साइड की पैदावार में इजाफा कर सकते हैं। इस रिसर्च ने दिल की सेहत, ब्लड प्रेशर कंट्रोल और मजमूई सेहत पर मुस्बत असरात मुरतब किए हैं। डॉक्टर ब्रायन ने इन नताइज को इस्तेमाल करते हुए नाइट्रिक ऑक्साइड पर मबनी थेरेपीज भी तैयार की है, जो मुख्तलिफ तिब्बी मसाइल के लिए कारआमद साबित हुई है।
रानी, रिसर्च करके बताओ और उनकी क्या रिसर्च थी जिसमें उन्होंने नाइट्रिक ऑक्साइड को एज अ हार्मोन इफेक्ट बताया?
जी डॉक्टर खान, डॉक्टर नेथन ब्रायन की एक और अहम तहकीक नाइट्रिक ऑक्साइड को बतौर हार्मोन बयान करती है। उन्होंने साबित किया कि नाइट्रिक ऑक्साइड खुलियों के दरमियान सिग्नल्स पहुंचाने में हार्मोन्स जैसा किरदार अदा करता है। ये तहकीक दिल, खून की नालियों और आसाबी निजाम पर इसके मुस्बत असरात को मजीद वाज़ेह करती है, जो नाइट्रिक ऑक्साइड के इलाजी इस्तेमाल की राह हमवार करती है।
ओके, आइए हम सुनते हैं डॉक्टर नेथन ने एल्डरली पेशेंट्स में और कोविड में नाइट्रिक ऑक्साइड का क्या रोल उन्होंने एक्सप्लेन किया है, और डॉक्टर नेथन ने अल्जाइमर और वुंड केयर में ऑल्सो नाइट्रिक ऑक्साइड का अहम रोल बताया है। तो आइए सुनते हैं उनकी ज़ुबानी। You're involved in a lot of research and you're trying to produce nitric oxide, and you're involved in some trials, and some of them are involved with COVID-19.
Right.
As we know, COVID-19 has had a devastating effect worldwide, not just America. Can you shed some light in what are we trying to, or what are you trying to do? What are the therapies we're looking at with nitric oxide, and how are they going to be utilized to combat infection or just other diseases or aging?
I think the answer is all of the above. There's really no indication where nitric oxide would not be beneficial when administered to the right patient at the right time at the right dose. So, as you mentioned, we started in 2020 with COVID during the early outbreak of COVID. And what we quickly realized was that the people that were getting sick and dying from COVID were the same people who get sick and die from the seasonal flu every year. So, this is a respiratory virus, but it was the people who were nitric oxide deficient. Who is that? That's the elderly, diabetics, smokers, previous heart attacks, kidney disease. So, the vulnerable, the people who had all the symptoms of nitric oxide deficiency, were the ones who seemed to be hospitalized, were put on a mechanical vent, and died usually within 10 to 14 days of exposure, onset of symptoms. So our thought process was, because we knew since 2005 that nitric oxide inhibits the coronavirus from replicating. So if your body can't make nitric oxide, if you're exposed to a respiratory virus, whether it's influenza or RSV or a coronavirus, then a healthy person mobilizes an immune response. The macrophages and neutrophils produce a lot of nitric oxide, and it prevents the virus from replicating. And if you can prevent the virus from replicating and propagating to other cells, then you can prevent the illness associated with viruses. But if you can't make nitric oxide, you can't mobilize an immune response. The virus takes hold, it propagates, makes people sick, reduces the oxygen carrying capacity of hemoglobin. Patients become hypoxic. Put them on 100% oxygen, they don't get better. Put them on a mechanical vent, and they die. So that was the entire chronology of onset of symptoms. So our thought process was, let's get these patients early. Within 72 hours of onset of symptoms or a positive PCR test, let's dose them with our nitric oxide generating drug and prevent hospitalization. Because as you know, as a critical care physician, pulmonologist, the ERs, the hospitals were overrun with acute respiratory illness from the coronavirus. Right. And so our thought process, can we keep people out of the hospital, keep people off mechanical ventilators, and hopefully keep people alive? And that was the design of the study. And so we published our study, I guess last year, but we stopped the study because, as you know, COVID kept changing. And our primary endpoints were admission to the ER, or hospitalization, admission to the ICU, and then death. But as the COVID and the variants changed, people weren't getting as sick, and so people weren't being hospitalized. So we couldn't hit our endpoints, and we couldn't enroll patients because patients weren't getting admitted to the hospital, and so we weren't going to hit our endpoint. But what the beauty of that study was is we were actually making patients better. We improved their blood oxygen saturation. The symptomology was decreased by at least 2 or 3 days. But most importantly, we treated over 600 really sick patients, and some patients on many different, dozens of prescription medication. And the safety of this drug, as we were administering our nitric oxide lozenge, there was no safety signal. So even in really sick, highly susceptible, high risk polypharmacy patients, there was no safety signal with the nitric oxide drug. So now we've established safety through our COVID study. In the most vulnerable population, we established safety. So now, today, we've got drug therapy for ischemic heart disease. We've got drug programs for Alzheimer's, which I think nitric oxide therapy will completely eradicate Alzheimer's.
Well,
and then we make a topical drug for diabetic ulcers and non-healing wounds. Because if you look at wound care, nitric oxide prevents a hyperemic response, kills the infection in the wound bed, and we can, we're taking 3, 4, 5-year-old non-healing wounds and healing wounds within a period of a couple of months.
It sounds very groundbreaking. Alzheimer's disease you just mentioned, Dr. Bryan. Tell us a little bit about that. We have a big audience, a lot of followers, a lot of people depressed. And you're saying we could eradicate or reverse Alzheimer's?
Absolutely. Well, as you know, let me qualify that. The success or failure of any drug candidate is on the design of the clinical trial and in which patients you enroll. So here's what we know about Alzheimer's. Number one, before it's diagnosed as Alzheimer's, we call it vascular dementia, right? So there's a vascular component to that, which means there's decreased blood flow to certain regions of the brain. And you can visualize this through SPECT scans or functional MRI. Number two, there's insulin resistance. And in fact, Alzheimer's is a metabolic disease, oftentimes referred to as diabetes type 3. And then number three, you get oxidative stress, you get inflammation, and you get immune dysfunction. And then at the end of the day, you start to get protein misfolding. And then this shows up as the tau tangles and the amyloid plaque. And so drug companies developing monoclonal antibodies or drug therapies targeting the amyloid and the tau tangles, those drugs can't work. In fact, they don't work despite billions of dollars, because that's a consequence of disease. It's not the cause of disease. So when we start to interrogate root cause of disease, including Alzheimer's, we have to overcome the lack of cerebral perfusion, the focal ischemia. We have to improve insulin signaling and get glucose into the neurons, the primary energy source of the cell. We have to mitigate the inflammation, oxidative stress, immune dysfunction, and prevent protein misfolding. And nitric oxide checks all those boxes. When we give nitric oxide, we dilate the blood vessels, we improve cerebral perfusion. We can demonstrate this before and afters in SPECT scans. We published in 2011 that nitric oxide is part of insulin signaling and required to get glucose into the cell. So if the cell can't make nitric oxide, you can't get glucose into the cell. And then many of my patents, or several of my patents, are on a method of reducing inflammation. It reduces C-reactive protein, shuts down oxidative stress, and prevents the immune dysfunction that we see in all chronic disease. So when we start this trial, we'll enroll patients that are, far enough along with an early diagnosis of Alzheimer's, because we want to show two things. Number one, we want to show that we can slow progression. That's kind of the minimum barrier, right? At best, we want to show that we can regress disease. And that's the objective of the clinical trial when we start our Alzheimer's study, is let's take patients early on, show that we can slow progression at worst. At best, we can show regression of disease. And then catch these early on through early diagnostics, early SPECT scans, implement the nitric oxide therapy, and completely prevent.
You mentioned that you're going to be able to institute nitric oxide, and you'll be able to give these to the patients. Would this be in a pill form, injectable form? And do you have already established how you're going to measure the levels and set points, how you're going to think that this is effective treatment?
Yes. So remember, nitric oxide is a gas, so it's not something you can put in a capsule, pill, or swallow.
Sure.
So we have to deliver this gas. And this is really kind of my claim to fame, is I've developed the only solid dose form of nitric oxide gas. So prior to that, nitric oxide was only administered in an inpatient setting, primarily in a critical care unit, inhalative nitric oxide therapy for neonates with pulmonary hypertension, or even off-label for adults.
Yeah.
So this orally disintegrating tablet, we call it an ODT, you place it in your mouth and it dissolves over 5 to 6 minutes. But because we control the nitric oxide release through that specific dissolution rate, we're delivering a certain amount of nitric oxide over a specified period of time. And we titrated that in because once we knew how much nitric oxide a normal healthy person makes in 24 hours, we want to give that back, right? And so the analogy I use is if you've got a patient with a vitamin D of 20, you titrate in to optimize that at 80, right? And so that's kind of the dosimeter we use. But unfortunately, there's no blood labs or numbers that we can treat with nitric oxide. So we have to, number one, recapitulate physiology. And then for every disease indication, we have to do dose titration studies to figure out what's the safest, most efficacious dose for that indication. Because I predict that the dosing regimen and the dosage that we use in a single application may be different for Alzheimer's as it was for ischemic heart disease. So those are the studies we have to kind of work out with the FDA to make sure that we're delivering the right dose for the right indication. But what we've discovered is that whatever we're doing, it's extremely safe. So we've established safety. Now it's just the dosing regimen to establish efficacy for Alzheimer's versus.
रानी से गुफ्तगू करेंगे. रानी आप मीनवाइल रिसर्च करो इसके बारे में कि अल्जाइमर में वुंड केयर में डॉक्टर नेथन ब्रायन की क्या पब्लिकेशंस है और उसमें उन्होंने क्या रोल बताया है.
डॉक्टर नेथन ब्रायन के मुताबिक अल्जाइमर में नाइट्रिक ऑक्साइड की कमी दिमागी खून की फराहमी को मुतासिर करती है, जिससे मेटाबॉलिक अफाल मुतासिर होते हैं और सोजिश बढ़ती है. उनकी तहकीक में ये भी बताया गया है कि नाइट्रिक ऑक्साइड की सतह बढ़ाने से दिमागी सेहत में बेहतरी आ सकती है. जख्मों की देखभाल में नाइट्रिक ऑक्साइड इन्फेक्शन को कम करके और खून की रवानी बेहतर बनाकर जख्म भरने के अमल को तेज करता है.
आखिर में डॉक्टर नेथन ब्राउन ने अपनी किताब के बारे में कुछ बताया है और उस किताब का नाम है सीक्रेट्स ऑफ नाइट्रिक ऑक्साइड. के नाइट्रिक ऑक्साइड के सीक्रेट. गिव अस आवर ऑडियंस अ मैसेज. व्हाट वुड in your view what would be the important things that you would like them to know and regarding generally just nitric oxide, and then your final message. Basically, what would
Yeah.
you like to impart to them?
Now, I think people need to understand what nitric oxide is, what it does, and what they're doing that may be disrupting their own nitric oxide production. I'll do a shameless plug because everything I've just finished my latest book called The Secret of Nitric Oxide, Bringing the Science to Life. And in this book, I reveal what nitric oxide is, how it was discovered, what led to a Nobel Prize, and then really share my personal history of discovery and innovations. And we talk about the drug trials. We talk about things that you're doing that may disrupt nitric oxide production, and then give practical advice that's clinically proven to restore the natural production of nitric oxide. So I think people need to understand this because there's only two people in the world who need nitric oxide. It's number one, if you're sick and want to get well, you need nitric oxide. You need to understand the importance of this molecule. Number two, if you're well and don't want to get sick, you need to understand the importance of this molecule and stop doing the things that you may be doing that's disrupting its production and maybe putting you on a very slippery slope to the advanced progression of chronic disease or the onset progression of chronic disease. But everything is chronicled in that book. I'm very proud of my publisher, Brick Tower Press, and my agent, Alan Morell, and creative management partners. It was a 2-year project that we just launched the book last month. So I highly encourage everybody to read the book. And then you can find me on YouTube. I have my own YouTube channel, Dr. Nathan S. Bryan, Nitric Oxide. I'm searchable on PubMed, published over 100 peer-reviewed papers in the scientific and medical literature. So yeah, I think we just need to get this information out there because it's
रानी, हमें रिसर्च करके बताओ कि इस किताब में डॉक्टर नेथन ने क्या चीजों का इंकशाफ किया है।
डॉक्टर नेथन ब्रायन की किताब द सीक्रेट ऑफ नाइट्रिक ऑक्साइड में नाइट्रिक ऑक्साइड की दरियाफ्त, जिस्म में इसकी पैदावार और मुख्तलिफ बीमारियों की रोकथाम में इसके किरदार पर तफसील से रोशनी डाली गई है। किताब में नाइट्रिक ऑक्साइड की सतह बढ़ाने के लिए ग़िज़ाई और तर्ज जिंदगी की तजावीज़ भी शामिल है। डॉक्टर ब्रायन ने नाइट्रिक ऑक्साइड के तिब्बी फ़वाइद और इसकी कमी से पैदा होने वाले मसाइल पर भी बहस की है, जो क़ारीन को इस मॉलिक्यूल की अहमियत से आगाह करती है।
तो नाज़रीन, आपने सुना कि डॉक्टर नेथन ब्रायन ने अपने शोबे में किस तरह से नाइट्रिक ऑक्साइड को रिसर्च कर रहे हैं और इसके बारे में क्या क्या नई चीज़ें का इंकशाफ कर रहे हैं। वो बता रहे हैं कि ना सिर्फ अगर दोबारा कोविड हो तो उनके पास मेडिकेशन देने के लिए एक ज़रिया मौजूद है। नाइट्रिक ऑक्साइड पहले गैस फॉर्म में था, लेकिन अब उन्होंने इसकी थेरेपी ईजाद की है कि वो इसको एक टैबलेट फॉर्म में या उससे मिलती जुलती फॉर्म्स में वो बॉडी को दे सकते हैं। वो और उससे क्या असरात है, ये पहले कभी डिस्कवर नहीं हुआ था। ये एक मेडिकल मेडिकेशन है। वो उन्होंने अपनी स्टडीज़ FDA से अप्रूव भी करवा ली हैं, R&D से अप्रूव करवाई हैं और वो आगे से फिर रिसर्च में अभी जाने वाली है। हमारी सारी दुआएं हैं उनके साथ कि उनकी ये रिसर्च कारामद साबित हो सके, क्योंकि इससे ना बहुत ज़्यादा लोगों का, डिमेंशिया लोगों का और हार्ट डिजीज़ वाले पेशेंट्स का, और जो क्रॉनिक वुंड्स, जिनके क्रॉनिक जिस बॉडी पे जिस्म है, निशान है, उनकी हीलिंग में आप और जिसमें डायबिटिक मरीज़ों का बड़ा ज़बरदस्त उसका इलाज हो सकता है। सो इसके साथ मुझे और रानी चैट जीपीटी को इजाज़त दें। हम आपकी खिदमत में फिर दोबारा हाजिर होंगे। अगर आपको ये शो पसंद आ रहा है तो प्लीज़ इसको लाइक, सब्सक्राइब और शेयर करें, और हमारी ऑडियंस को और रानी जीपीटी को फीडबैक देना ना भूलिएगा। अस्सलाम वालेकुम, टेक केयर।
मेरी तरफ से, डॉक्टर खान की तरफ से और रानी चैट जीपीटी की तरफ से हमें इजाजत दीजिए। आप सबका बहुत शुक्रिया। खुदा हाफिज। अगर आपको ये शो पसंद आया है तो प्लीज इसे शेयर करें, अपने कमेंट्स लिखें और सब्सक्राइब करें।